everybody, Susan Sanford from Vineyard Complementary Medicine. Tonight I am going to talk to you about how to do some simple home taping techniques for 4 body parts. I picked my favorite taping techniques for what I see as the most common body parts that would benefit from taping. A lot of people have taping kinesio tape at home. If you don't, really easy to get. You can order it from Amazon. You can get it at any of the pharmacies on island or any of your local pharmacies. The 4 body parts that I'll be going through are lower back. Well, we'll start with that because that's the most common issue that people struggle with. Lower back, knees. I'm going to show you how to tape knees because I find that the taping is really, really effective for relieving a lot of knee pain. Then we'll do your shoulder, and then we'll do an elbow. Really easy. You will need a second pair of hands for the lower back and the arm ones. You can do it, but it's really the best to have a second pair of hands to do that. So you can refer back to this video in case you don't have a second pair of hands this evening. So I'd like to introduce you to MJ Magarasi. He has agreed to be my subject tonight for demonstration. So here we go. This is tape. I happen to have hot pink, but they come in all different colors from boring beige, pink, blue, black. It doesn't matter. The colors do not matter with the tension or anything like that. Let me show you. Before you tape, what you need to make sure, there's some basic concepts. The tape is on a piece of paper already, and when they roll it when it's on the paper, it's already at a 25% stretch. Now what you can see is, and I'll show you, can we see it there? There we go. See how that cool little design is there? That's meant to work with your body's own fascial and muscle system. Really, and ultimately how I envision it, it's about creating space between your skin, your fascia, your muscles, and then the way and the direction that you tape will also affect on how the muscles react. I am going to give you a I call it quick and dirty. It's not an exact science. There are thousands and thousands and thousands of videos on YouTube about how to tape in a very, very specific manner depending upon your issue. I'm going to show you almost like the idiot's guide on taping that should really alleviate probably 80 to 90% of the issue. So let me just show you my favorite taping techniques, and just know that the tape is already rolled on a 25% stretch. That's a really nice general amount of stretch to provide you support and to give you some pain relief. So the priority tonight is on pain relief. That's what I'm going to show you how to tape. So first, let's start with lower back. MJ, can you stand up, please? All right, so pull this up, hold that up, please. I'm going to pull this down. I will keep it PG-13, don't worry. Okay, so what you do is you find the dimples. The dimples are level with, sorry, I'm going to touch it with my hands here. So you find the top of the pelvic bones here. Bring your thumbs around and turn around. The dimples are right here. Okay, so most low back issues are between L4 and L5, and that's where we're going to start the focus. So what you're going to do, MJ, actually, what I'll show you first, is you're going to take 1 inch off the end of the tape and rip it. So you're going to rip the paper from that 1 inch. The reason why you do that is because the last inch of any taping, you do not want any tension whatsoever. Okay, so this really helps to prepare you for that. So what I'm going to do with MJ is I'm going to peel the center part off. And I'm going to estimate what a 25% stretch is. So now that the paper is off, there's no tension. So I'm going to pull it real tight. That's 100%. That's nothing. I'm going to go to about 20%, 25%, okay? MJ, please bend forward as far as you comfortably can. Right across those dimples, use that as the bottom border of the tape and just stick it right on. Okay, I'm going to pull the paper off. No tension on that inch. Last inch, no tension there. Activate it. The adhesive activates with heat, so a little friction will activate the adhesive. Come sit up. If you're working with somebody, or if you have a lot of pain and there's no way you're bending forward, then you do it sitting on a stool with no back, and you just sit, because the sitting is a form of forward bending. So that's a modification. If there's no way, because if you just like were doing yard work and you lifted something and you straightened it, really this is great for acute back pain. If you're not able to bend over, then just sit and do it. Next, I'm going to take 2 pieces of tape. So this is called an H tape technique, very general, really easy low back taping technique. So 1 inch there, 1 inch there. Hold please. 1 inch, 1 inch. I'm going to take the inch off. All right. So what you do is when you first apply, so this is a different way. So before I did the stretch and apply, this one I'm going to apply it with no tension. Okay, let me see the other one, please. All right, so the tape is secured. Now go ahead and bend forward, please. And then the roll off. So here comes the 25% stretch. Just rolling it right off, all the way up, about 1.5 inches away from the spine. Okay, last inch, no tension. Roll it off. Last inch, no tension. Activate it, activate it. Okay, this is called the H tape technique. Come stand up. And you can see why. Looks like an H. Now, if you can come, I'm going to come a little bit closer. I'd like everyone to see. If you guys can you see the wrinkles in here? Okay, wrinkles are good. Okay, wrinkles mean that you applied the tape correctly. And I don't know if you can see it, but there's some nice wrinkles there. There's some nice wrinkles there. Okay, that means we've applied the tape correctly. It's creating space, allowing, if there's any swelling or inflammation, allowing for that lymphatic fluid to really kind of flow out. Okay. So again, if you are having an acute strain and there's no way you're bending forward, what you do is you apply it while standing, then sit, and then just apply, and then just roll the tape up, because again, sitting is a form of forward bending. That's the low back pain. It can be used for acute, it can be used for chronic. It's a really great all general taping technique for lower back. Next, we're gonna move on to knees. MJ, have a seat, please. I'm going to show you a great technique. Actually, I'm going to show you 2 techniques. Can you pull your pant legs up, please? So when you buy your tape, most of the tape that they sell at the pharmacies these days they come pre-cut. They come with the corners already rounded. If it doesn't, then what you want to do is, these are about 4 segments. So when you buy the tape, there's squares. So it's 1 square, 2 square, 3 square, 4 square. So you're going to do 4 square lengths long if you have to cut it yourself. You round the edges so that those little the corners don't flip up like little dog ears. So they tend to stay a lot better if you round the edges, which is why they come pre-set like this. And if they don't, then you just curl the edges yourself. All right, so most pain in people's knees, what they determined, comes not from the joint, not from the cartilage, not from the ligaments, but from what's called the retinaculum, which is the fibers that surround the kneecap. So when you tape your knees, you want to make sure that you really get those fibers that surround the kneecap. Word of the day, retinaculum. So that's what we're going to tape. And that really, really helps to relieve a lot of knee pain. So you take the last inch, take the paper off, and you apply it. Can you come actually a little bit closer? So let's take the mulch here a little. There we go. Okay. And there's this little nub right at the bottom, below your kneecap. I would say if you take your hand, it's about a hand's distance, or your 4 fingers, below the bottom of your kneecap. It's called your tibial tuberosity, okay? It's the nub that we're gonna use to secure the tape. Whenever you apply the tape, again, you wanna create what's called anatomical neutral position. Anatomical neutral is as if you're just standing like this. So you want to make sure that you put whatever body part, when you're securing that tape initially, pretend that part is in this position. So what we're going to do is we're going to straighten MJ's knee and apply the tape to that tibial tuberosity, that nub, right below the kneecap. Secure it there, all right, and I'm going to secure the other one as well. Make sure that when you do, if there's any overlapping tape, make sure that you secure it to skin. Don't secure it on top of the tape because it won't hold. So I'm going to do it just a little bit below the tibial tuberosity. Straighten your leg. Okay, then, so that's pretending we're in neutral position. Then when you apply the tape, again, the structures need to be on a stretch. So remember, apply it in neutral. The tape needs to be on a little bit of a stretch. The body part needs to be on a little bit of a stretch. So bend your knee, pull this up a little bit, and we're just gonna roll it off to the tension that the paper is applied. Again, making sure that we're bordering the kneecap because we want to hit that fancy word, the retinaculum of the knee. They're activated a little bit. All right, come stand up. And here, come really close. I'm going to show you. You know that it's a good technique if you have wrinkles. See all those wrinkles? That's good. Straighten your knee all the way so you get full effect. Oh yeah, look at those. That's good. That's good stuff. The wrinkles mean space. Okay, go ahead and sit down. Actually, you know what? Let's do shoulders next. So that's your knee. Next, let's do the next most common body part that we tape. Can you pull your shirt off, please? Okay. Typically, most shoulders have pain right in front here. So right in here is your supraspinatus. I'm going to guesstimate that 70% of the shoulder impingement issues come from this area here, whether it be your supraspinatus or your biceps tendon. They're all within a tape width distance of each other. So what I'm going to do is I'm going to show you again a very general taping technique for your shoulder. There are very specific techniques for strengthening, for calming down spasms. Again, I'm focusing on pain relief. This is what I've used when my shoulder has been really bothering me. Again, take the 1 inch off. You're in neutral position. Make sure that when you put the tape up that you are going to hit the body part. So, I'm going to align it there. Let's take that last inch off of there. I'm going to apply it, so in neutral position. Good. So I'm going to secure it down closer to the biceps, right about there. And what you can do is just make sure that you're hitting the parts that hurt. That's the biggest, the biggest focus here and the biggest intention. So you apply it in neutral position, and then you want this on a little bit of a stretch. So you stay right there. Just bring your arm back behind a little bit so these structures are on a stretch, and just roll the tape off. So bend your head away a little bit. There you go. Again, this is super simple technique. I call it the quick and dirty for pain relief. That's for your shoulder. And then the last technique I want to teach you is for elbows. Again, have had some elbow issues, had some, a strain to, typically what they call tennis elbow. And I found that the taping technique was just amazingly effective. So let's say it's MJ's right elbow. Most elbow issues are right on the bony part. It's called your the lateral epicondyle. So tennis elbow, lateral epicondylitis, whatever elbow pain that you have. Again, we're going to just do a simple space correction where you take the middle part of the tape off. All right, get a sense. This is no tension. This is full tension. Let's release it. Say this is about 20%. With elbows, typically we want a little bit more tension, like about there. Okay, so MJ, what you're gonna do is put this on a stretch. So wrist is bent, elbow is behind you. Okay, find the tender spots, which is right about there. You pull the tape about 50%, and you do what I call the haya. Haya right over the involved area. Make sure you hit it, all the tender spots. If you have to apply more tape to make sure you get it all, then that's great. Okay, and then there you go. Check it out. Great. Thank you so much. You can have a seat. So the tape can be worn when you wash, when you take showers. Just make sure that you don't scrub it, so that you'll peel it off. Pat it dry when you're done. It should be good 3, maybe 4 days, depending upon how much you beat it up. Be careful when you put your clothes on and off, with your knees, your pants up and down. Same thing with your lower back. Make sure you have clearance with your pants, clearance with your with your shirt and your jackets as well. So they should be good for 3 to 4 days. Again, if you know what's wrong and it's been diagnosed, then absolutely, try to do some home taping. If this doesn't work, or if it gets worse, or if you really are not sure why you're having your symptoms or your pain, of course, you're going to call your healthcare practitioner, whether it be your physician, your nurse practitioner, or your physical therapist, to make sure that you get a really clear diagnosis of what's happening. You obviously don't want to do these, and I'll just give you some general precautions. Not over any infected areas, not over any open areas. Use common sense and, get yourself feeling better. If you have any questions, please go to our website. Our website is vcmpt.com, as in Vineyard Complementary Medicine Physical Therapy, vcmpt.com. And again, my name is Susan Sanford from Vineyard Complementary Medicine. Thank you for joining us. And thank you, MJ.